right, welcome back to YouTube, Instagram, wherever you're getting this from. I'm Dr. Jordan Feigenbaum. This is Dr. Austin Baraki. We're gonna stream.
Does that need to not be offline?
No, it comes. It's just like a, it's like a delay.
All right, you're the expert.
Well, I'm something. I don't know if I'm an expert, but I'm something. We're trying to stream across multiple platforms right now. So the way this works, if you have a question for us on Instagram Live, we will answer it here. If you're on YouTube and you submit a question, we'll answer it, and it'll be saved across all of these things.
There it is. I see it now. Stream health. Look at that. It says.
It does. It says stream health.
What do you do for stream health?
Well, I take some Prazosin.
I take Flomax, yeah.
Flomax and Prazosin together. Yes.
All right.
Barbell Medicine live stream is greater than rewatching Scrubs. I like Scrubs.
I was never a Scrubs guy.
You're too young for that.
Well, I just don't like medical TV shows, I think.
Well, people always ask who's JD and who's Turk.
What do you say?
I think that I'm Turk.
All right.
All right, let's start with some questions here from Instagram Live. What's in the glass this evening, gentlemen?
Pull the bottle over.
Well, we don't have to put that on, you know. It's Weller. We're drinking some Weller, like special edition, I guess. Some kind of edition. Let's see. Is Joey Flex a good coach, or has he been blessed by having really good athletes, people who respond well? I mean, yes. Like, I don't think that you could be a really, really bad coach and have the amount of success that he's had. I can't comment specifically because I've never seen any of his programs. I've never seen any of it, you know?
I don't know anything about like the way he coaches, but
No.
he certainly does have a large cadre of
Yeah.
high performers. So
Yeah, I like him as a human. I mean, we trained together a few times
Oh,
in
you
LA.
did?
Yeah. And but yeah, so I don't think that with that amount of people, you say, oh, it's all just luck and good genetics. That'd be pretty reductionistic. I wouldn't want to do that.
sure.
All right, is that drink keto? Yeah, I think so. It says it on the. It doesn't say it.
Well, you can go into alcoholic ketoacidosis. So
Yeah.
in some
And
ways,
before
it's
beer,
totally
potomania.
totally keto.
Yeah. Yeah. All right, so let's see. After the bridge, do you recommend the slow or fast peaking template for an intermediate lifter trying to test 1RMs 485, 360, 585? So those are decent numbers. A few things here. One, I would stop using the term intermediate lifter. You're just not a beginner. I don't know if the intermediate designation helps you. I don't think it does anything. So I probably wouldn't do that. And neither of us can predict whether the fast or the slow one's going to work better for you because we don't have any history on you. And since you don't have any history either, I don't know what we could do about, or how we could predict which one is going to work best for you. So I would probably recommend trying one this time and then trying the other one the next time and see if you like one better.
Sure.
All right. Fair enough.
I think that in general, most people who are going to be, using these sorts of things, if I had to guess, I think most of them don't need a particularly long period of time to peak their performance.
Yeah, no, I know.
My
Yeah.
default would probably be to start out with the faster one for somebody, but the whole point of this stuff is that it's not necessarily tailored or individualized to you, and you need to experiment and learn from how you respond to these things. So
yeah, fair enough. Hey guys, can you describe the difference between tendonitis and tendinopathy? No, other than time course and like how fast you would expect it to maybe like resolve. Maybe.
I don't really think that tendonitis is a useful term. I don't really use
I
it. I don't use that term with really anybody. Tendinopathy itself is a big umbrella term, kind of comprising various quote-unquote pathologies of the tendon.
Sure.
Tendonitis, that ending in medical lingo implies a degree of inflammation is present, which in general is not like the dominant issue going on with a lot of these tendon-related disorders. So I think that you can find some data that says, oh, there's like a handful of immune cells in there, and that might suggest a low degree of inflammation, or there's no inflammation, and the science goes kind of back and forth on it. But I think what it comes down to is if you treat somebody with anti-inflammatories for their quote-unquote tendonitis, if you give them a whole bunch of ibuprofen, it doesn't solve the issue. It doesn't really fix much of anything.
No, usually no.
Yeah. So, you may get some sort of a transient placebo effect out of it, but if you return to the same loading of that tendon, then you tend to re-precipitate the same symptoms unless you had just a natural resolution of the issue. So
you said re-precipitate?
I guess that's maybe a word.
Yeah. I like that.
So we treat tendinopathy as a loading-based issue and don't really worry about inflammation. We don't use the word tendonitis. So
yeah, I would never distinguish between tendinopathy and tendonitis because it doesn't change what I do.
Yeah.
And it doesn't change my expectations about really anything. It's just a time wasted on useless detail.
It's just pain.
Yep, it's pain.
Yeah,
sure. When do you start your nutrition LP? As soon as it becomes a validated thing.
Well, too salty?
Next question.
Next, moving right along. All right. High bar or low bar for the average lifter?
Doesn't matter.
That's true. It doesn't matter. All right, well, let's expound upon that. Why doesn't it matter?
Well, so when you initiate training, you should be initiating training with some kind of goal in mind, and the degree to which the specific lift selection matters depends on the specificity of the goal that you're going after. So when you hear people who say they want to train for general health, first of all, that's not a particularly well-defined thing, but that's because it's so general that it doesn't particularly matter whether you low bar or high bar squat. We've talked about this before in the sense that if you had a study where you randomized a cohort of individuals with diabetes to squat with the low bar technique or the high bar technique, we would not expect to see any significant difference in how their average blood sugars or their blood sugar control is at the end of the trial. Sure. As one example of a health metric. Similarly with high blood pressure, if you had one group squat high bar, one group squat low bar, we wouldn't expect to see a significant difference in their outcomes.
Yeah, I agree.
If the metric of choice was the absolute heaviest weight that somebody could possibly lift in a powerlifting competition, then we would suspect that you would see more folks do better with a low bar squat. Maybe. But we see plenty of the strongest people in the world putting up even heavier weights as weightlifters in their training halls, squatting 800 plus, like Mart Syme and stuff like that with the high bar technique. And
because they're strong.
They're just strong. So I don't think that you're gonna, that it really agonizing over this decision particularly matters outside of the lift variant that you tolerate the best and that you can train the most productively for the longest period of time.
Yeah, that's exactly where we go on like bench press grip width. Like, so the thought would be if you have a wide bench grip, you have a reduced range of motion that sets you up for success in the bench press. But I can't tolerate, me personally, for instance, can't tolerate a wide bench grip. So me doing that, even though it cuts off my range of motion, actually would decrease my bench. So I use a narrower one and have been successful with it because I've learned how to do that. So despite like this analysis of the low bar squat versus the high bar squat, it's going to be an individual preference based on your style, your levers, and what's most sustainable for you to actually train with enough frequency to make your lifts go up. Same deal for the conventional versus sumo. Now, the only thing I want to add is that this thought process that the low bar back squat is uniquely more beneficial because it activates more muscle mass, recruits more motor units, and therefore is better, has never been substantiated with any science. And when looked at, under the scientific eye, it has fallen on its face. This theory has never held up. So in fact, if you were looking for, which squat square variant uses more hamstring, they use the exact same amount in the same person. If you're looking for, which one uses more erector, spin it. Same amount of activation to the best that we can tell within individuals. And then the people saying that, low bar is better, just say, that doesn't count. That doesn't count because, it doesn't fit my bias.
All right, moving along.
The discussion is barely even worth having.
I agree.
I agree. So yeah, again, whichever lift variation is something that you can train consistently for a long period of time. That's what I would do.
Because the idea is that with the numerous benefits that are to be had from resistance training, we should be aiming to make it as accessible as possible and not as rigid as possible. So we just say if you're training for health or if you're training to not be a powerlifter, you're training for where the specific exercise is not a part of the sport, then it really matters relatively little which one you choose.
Yeah, or front squat.
You live a full and complete life doing only front squats.
Yep.
All right, moving along. What is the best way to maintain or gain strength when cutting? High protein intake, not overshooting RPE. Both of those things would be general tenets of good strength conditioning practices. Like, hey, eat enough protein to maximize your muscle protein synthesis and therefore maximize your recovery processes from that particular standpoint, not globally.
because there are more things that go into recovery than just muscle protein synthesis. And then also, not overshooting your RPE, like not missing lifts, would be a good way to like set yourself up for success long term with your training. I think the best way to get stronger whilst cutting is the same way you get strong when you're not cutting. Follow good programming, something that you're excited about, something that follows a progressive overload and allows for auto-regulation based on performance and recovery metrics from that particular day, and builds upon itself over time. So anything that we put out, I would feel fairly comfortable recommending as like a starting point to get your programming under control. It doesn't mean that it's perfect, and that in fact, I would freely admit that our programming doesn't work for everyone.
We say that all the time.
Yeah, 100%. But I think it's we're giving you the tools that if it doesn't work for you, then you kind of know, all right, well, here would be my next move. That's the idea. All right.
Let's see. Rosenberg says, I'm cooking dinner and not wearing a shirt, which is usually what you're doing, but ironically, you're wearing one.
We're wearing our signature shirts.
I believe we are.
What are you going to do, not train and nuance things? So you're welcome, Internet. This is for you.
Let's see. What happened to the R8? The R8.
You want to tell the story?
Well, yeah. So all right. I've been fairly busy this last week. I've had visitors come in. Jess was here. Austin's here. We had a seminar this past weekend. It's been long. We've been doing a lot of stuff. And then after the seminar, we got in the car, started it up. To Austin's recollection, it did not sound as robust as it normally does. However, I thought it was fine. So we take out of the parking lot and we're getting on the highway, and the car starts misfiring, stuttering, sputtering, and ultimately stalls, and I coast onto the shoulder of the road. Call roadside assistance. They say, hey, we're going to pick it up. And they were like, are you going to wait for the tow truck, or do you want us to just do it? And I was like, oh, just pick it up. And they're like, cool, leave a key in the console. So I did, but they didn't send a tow truck, so it got impounded. And then I had to get it out this morning so that it could be towed to the dealership. So I don't know what's going on with it, but the car is in repair. It's a brand new car. Probably was just thirsty. Let's see. How do you guys go about studying and absorbing information? Well, I think that it's the same that anyone else does it. You continue to expose yourself to similar styles of information, or at least similar topics, and then ultimately you amass this sort of knowledge base that allows you to better understand things, and as a whole, and then also consume more new information a little bit more efficiently. So you could probably speak to this more, since it was while you're in medical school you got into training. Yeah. You started reading stuff and you're like, and it was relatively inefficient at first, even though you had been in medical science.
I think it's the combination of reading the stuff and then trying to apply it in some fashion that results in a little bit better kind of solidifying it in your brain. And additionally, teaching it to others makes it super effective. Or at least I think that the topics that I find that I can confidently teach about are the things that I have, grasped the best.
Sure.
So I think reading as much as you can, amassing that knowledge base, and then trying to communicate it to others in a way that they can understand. That process is a great way to solidify kind of a knowledge base in your head.
Yeah, I agree. Let's see. Would it be fine to add one shoulder exercise such as lateral raises at the end of the 3-day hypertrophy program? Would it affect recovery? Well, anything that's worth doing from a either muscular hypertrophy improvement standpoint or strength improvement standpoint can affect those things will affect recovery, right? There's nothing, you don't get a free pass.
There's no way you can add training stress without in some way,
affecting your recovery. Yeah. There are no biological free lunches here. You're gonna have to give a little bit. Doesn't mean that you can't do that. I just don't know if I can say whether that's appropriate or not for you. If it's your first time through, don't add anything to it. Second time through, maybe add something to it. Mm-hmm. Do y'all have any experience treating pain associated with interstitial cystitis? I do not have any direct pain or experience managing that.
Yeah. I've seen a few patients who have had it. The times when I saw it was a while back, and it was before I had this kind of steeping in a lot of the pain management stuff. Now, it is one of the more difficult conditions to treat, and when you read about some of the treatment modalities that they use for it, they like instill lidocaine into the bladder and do all kinds of stuff like that.
Oh, I do that daily.
Yeah, right.
That's my thing. I wake
That's
up
how you
in the
maintain
morning.
your stream health.
That's
like
right.
We were
Yes.
talking about,
Yes.
right?
Maintain
So,
stream health.
very difficult. I mean, I think that for any pain condition, that education is going to be a big part of it. But I don't think that. I mean, I'm sure that there are other facets to managing that particular condition that somebody with more experience would be able to speak to a little better than me.
Yeah, maybe.
Maybe, I would hope.
Sure, right.
Will you guys ever squat 700 and bench 500?
Maybe.
Yeah, maybe. The point is, it's funny. By the time that we do it, it won't matter.
Well, it already, yeah.
Because 20 other 93 kilos.
We could do it.
lifters.
We could do it now, but the problem is that I mean, there are 83 kilo guys who are squatting 700. So
yeah, and benching close.
I mean,
Yeah.
I think I'm capable of those numbers
Sure.
over the course of my life. Whether or not they'll happen, I don't know. We'll see.
Yeah, maybe when I'm David Rick's age, finally
there
get
you
there.
go.
Any plans to have Stan efforting on the channel? I don't. The weirdest thing. So Stan's great. Like, he's just and I think it's one of those deals. Like, he's been around for so long that he kind of understand. He's a little more mature than about this stuff than I think that you can be when you're newer, right?
Yeah, I mean, the cool thing was that he was telling us that he's actually for a long time watched a lot of our stuff, and which was surprising to us, and that kind of prompted his attendance. But he says that he follows all the references when we cite research for some of the stuff we talk about. He follows the references, and he told us about how he likes to go down the rabbit hole, and that's something we talk about all the time when you go down the reference rabbit hole. And he said, specifically quoting him, he said, "I'm realizing that the more I learn, the more I don't know about anything." And we were like, hey, did we just become best friends?
Yeah.
Because we say that kind of thing every day.
We both had some Monster Mash, and
So
it's a good day.
Yeah.
Did y'all listen to that McGill Evidence in Motion podcast?
I listened to the first 15 minutes of it, and I listened to the first 15 minutes of it on the recommendation of Jared Hall, who thought it was better than many of the other things where McGill had talked about some of these things. And by the end of those first 15 minutes, I was not super thrilled with some of the ways that things were being discussed. So I did not complete the podcast.
Well, yeah, it says the thing. People are like, oh, yeah, well, he says that the MRIs or imaging can be unreliable. That's, you guys say that. It's like, yeah, but then right after that he says, but I can palpate the defect. And it's like, nah, that's a non-starter.
He was kind of attacking radiologists for being incompetent when it comes to interpreting imaging findings. But then, he said that he could like feel someone's back and then predict exactly what was going to appear on the MRI after it was done, which was dubious.
Nope.
So,
what's your kappa, bro?
Yeah. Well, I think the claim would be that there isn't going to be a kappa, referring to an inter-rater reliability, because there's nobody else like him who can do this.
Nobody else like him.
There's no comparator.
Yeah, well, that's interesting. You have a hypothesis that you can't falsify it.
Unfalsifiable, sure.
Turns out when you do science, things are harder. All right,
on real people.
On real people,
not cadavers.
Not cadavers.
Yeah.
Yes, right. Citations desperately needed. If someone wanted nicer posture for body language purposes only, is there anything that can be done besides constantly reminding yourself to get into this desired position? This assumes that there is a nicer posture that is universally true. I think that if any posture that you deem to be nice is arbitrary. 100%.
And so if you want to consciously assume an arbitrary posture, you're going to have to consciously do that. I don't think you can, reprogram everything that you just exist in this arbitrary nice posture, whatever that means, Like, imagine an extreme example of like what some super bizarre posture that someone's like, I really want to train myself to be able to just maintain this, with no effort or unconsciously. I don't think that that's likely to happen.
I agree. All right.
Assuming that you plan to continue to move in the rest of your life.
Sure. So. What is your take on people saying that they are impaired by their pelvic tilt? My assumption is that they are not, in fact, impaired by their pelvic tilt. They are impaired by the person who told them that they have a pelvic tilt that is impairing them, and that is malpractice.
Yeah, it's a belief thing more than it is a true thing.
All right. What is so special about how our don't ask why do people ask us about like other companies, like we're gonna comment publicly on them?
I don't know.
What do you think of somebody else's program?
I think you should ask me a better question.
They want to see internet fights.
Yeah, there's plenty of YouTube channels already that do that. We're not. I don't care if you're getting people to train and getting people to take, control of their own nutrition or whatever. Like, I'm pumped on that. But if you want us to fight, like, go somewhere else. All right, carry on. Can you describe the difference between tendonitis? No, we already answered that. There's no difference between tendonitis and tendinopathy. It's just a name. They're both poorly described.
It's pain.
It's pain. How many days a week do both of you train?
4 days.
4 days barbell training.
Yeah.
With or without conditioning, if I feel like it.
Yeah, Austin apparently has ridden a stationary bike twice in the last 2 weeks. Killing the GPP game. All right, let's see. I had a tibial plateau fracture, ORIF, 3 months on crutches, 2 months back, lots of atrophy and some pain doing full range of motion body weight squats.
Did you lose the question?
I think I did. How did I do that?
Sounds like you would benefit from a consult with our rehab
Oh,
guys.
here we go. Advice?
Yeah.
Yeah. Well,
get a consult with our rehab guys.
if you're really struggling on like what to do, then yeah, I would definitely get a consult with Derek Miles or Michael Ray for like a specific plan. But if it were me, I would just train. Like, just, you can squat. All right, here we go. I'm in the military, need to train for the mandatory 3-mile run. I thought it was 2 miles.
The standard tests vary by branch.
Oh, all right. I see. 3-mile run. What is the best way to do this while also gaining or maintaining strength? Well, if you're not good at running right now, it's going to be very difficult to gain the most, as much strength as you would if you didn't have to also gain a bunch of cardiorespiratory, endurance. If you're asking me which modality you should pick to do your cardio at, the answer is very simple. It should be running. I would try to be running close to 3 miles, once or twice a week. It really just depends how far you're off. Like if you have no running capacity at all right now, then running 3 miles is likely to wreck you, and I wouldn't advise that. But if you can run 3 miles and it doesn't really take that much out of you, you're just a little too slow, then 1 day a week I would run 3.5 miles, and the other day I would do aerobic intervals, so like a 1-to-1 work to rest ratio, where you would run like 800 meters, rest the time it took you to run 800 meters, and repeat that until you get to like 2.5 miles. So 1 day's a little shorter, 1 day's a little longer, and then try to get your pace where it needs to be for your 3-mile run. As far as the programming goes, just you need to be on a good program. So like not LP, for instance.
Should we make bumper stickers? Like anything but LP. It's like,
All right, moving along. QB Financial Services. What an interesting YouTube. Like, does your channel have like
financial services?
Maybe it's his company.
Yeah, fair enough. All right. Look at buying a weight bench. Most of them are wider than the recommended 12 inches. Is that a problem? Is 12 inches the recommended width?
I think so, but I mean,
I couldn't vouch for that.
Yeah, I don't know.
I just get a Rogue utility bench.
It's a matter of your comfort. So if you've laid down on that bench, then and it's comfortable for you, then it doesn't matter.
Yeah.
But you don't want to have gotten completely used to training on one of a certain width and then get one that's like multiple inches wider. That's the reason why I hate the fat pad.
Yeah. Thompson pad. That's weird. I wouldn't get the wooden bench. I wouldn't get a Thompson fat pad. If I had to pick a recommend bench pad, I just get a Rogue bench.
I have a couple of Rogue utility benches. They do the
really
job.
good. Get the ones with rubber feet, because if you put on a wood platform, it won't move because they got rubber feet.
Yeah.
All right. How do you balance strength training within a very high and fatiguing military lifestyle training that's usually 5 to 6 days a week? Is someone having you do PT every day? Does that happen?
I'm not in the military.
Same. I don't know why you have to do PT or why you have to train otherwise 5 to 6 days a week. If you have to do that, that's not compatible with like powerlifting, but that doesn't mean you can't go to the gym and strength train. And yeah, your progress might be a little slower, but what are you going to do?
There you go.
Not train.
Yeah. An auto-regulated program will take care of it.
RPE would be super useful here.
Yeah.
What causes muscular hypertrophy? Motor unit activation over a long range of a specific range of motion times volume.
Plus muscle protein synthesis.
I suppose if you wanted to soundbite it, but
that's what it is.
Yeah, it's a pretty complicated topic in terms of the mechanisms and stuff like that. But
so you can do it 2 ways. You could lift heavy weights
Sure.
to near failure and accumulate volume there because you're activating a bunch of motor units whilst lifting the heavy weights. So heavy sets of 5, you can get some hypertrophy response there, especially initially if you're untrained because it's heavy and it causes you to recruit a lot of motor units. Okay. Or you can lift very, very light weights or light weights in general to near failure. And because of the fatigue that builds up in the set, you start recruiting more and more motor units and you get a certain amount of reps where you get that those motor units all recruited and they'll grow bigger as long as you supply them with the correct nutrition. The thing is, over time, you're going to need more volume, more reps where all those motor units are recruited. And then you can't do that by just lifting heavy weights all the time. Because you can't accumulate enough volume.
Because the trade-off is fatigue.
Correct. You get more fatigue, so you need a less fatiguing option. So how do you do that? You pick an exercise that's inherently less fatiguing because it uses less muscle mass or lighter loads, or your expectation is that it doesn't wreck you, for instance. So you compare a leg press to a squat. You can actually use more weight on a leg press than a squat, but most people would consider that to be less fatiguing. You're using less muscle mass total.
Overall.
Sure. Or you do higher repetitions where you're getting close to failure, and that's less fatiguing just because it's a lighter weight.
Sure.
Anything else?
Yeah, I think that's reasonable.
There's a chapter's more, but
yeah.
All right. Why are Instagram gurus pushing CBD oil, claiming it heals everything?
Why?
Money.
Yeah, I assume they're financially incentivized. Like, hey, put this discount code in bio, you'll get, $1 off every order, 10% or whatever, and that couple $100 or $1,000 or maybe more. Maybe tons of people are buying through their discount code is worth compromising their integrity. Look,
or they may not consciously be compromising their integrity.
Yeah,
but
sure.
They may have had some experience with the stuff. Maybe they had some expectations set and they used it and they got whatever actual effects the things has, which I don't think have been clearly defined or demonstrated. Plus whatever placebo effect you get out of having a high expectation that this stuff works, or like my favorite powerlifter or my favorite Instagram guru says this stuff works, and that augments the potential for placebo benefits out of it. So, everything we do, the majority of things that we do have some component of an effect and then some component of non-specific effects with variable balance between the two. So
Sure.
I think we need more information and more research on the stuff to determine what, if any, is a real effect of it and how much of the things that we see people report are placebo. Because, one of my favorite lines, I forget who said it, but basically the idea is that if something treats everything, it treats nothing.
Also treats nothing.
Yeah.
Yeah.
So.
Yeah, it cannot be a panacea.
Yeah, there's no such thing.
That's right. I guess the only thing that I would add would be that at present time, pharmaceutical grade cannabinoids, which are more potent, more pure, regulated, and more well-studied than CBD oil. Overall, the efficacy of those things on sleep, pain, anxiety, depression, eating, appetite, or whatever, are bad.
Yeah.
Like in many cases, making things worse. In many cases, not better than placebo. Not like they're equivalent to placebo, but like actually worse than placebo. And that's when everything's regulated, like made in a pharmaceutical grade lab, and
Sure.
what you're getting. CBD oils are not made in a pharmaceutical grade lab. There is no such thing as pharmaceutical grade CBD oil because there is no pharmaceutical CBD oil that's a pharmaceutical. And it's in the supplement industry that's unregulated, and you don't know the dose and you don't know what's in there, and the evidence does not suggest that even the higher grade, higher potency stuff has any positive effect. So I agree with you that it is very possible, it's probable even, that the people recommending it are like, yeah, well, it worked for me.
Yeah.
But there's an inherent problem in, you tried something, and because you retrospectively say, this worked for me, your recall bias, your own
Plus confirmation bias.
Confirmation bias, sure. Plus
expectancy.
All these things.
Yep.
That is a problem. And if you're in a position of power, I think you need to be aware of that.
That's why we talk about it all the time.
Well, why aren't we? Yeah, exactly. We do talk about it all the time. Look, if a person knows that CBD oil is trash and they recommend it and they're not using it because they know it's trash, that's fraudulent. And if found out, I would like to publicize that. All right, moving right along.
Are there benefits to consuming fermented foods? I mean, you're not going to live any longer if that's what you're like asking for.
I can't say that I have performed an exhaustive systematic review of literature on fermented foods. So
sure. Well,
maybe not. Same deal though, to the extent that people start adding fermented foods into their diet based on the recommendation of somebody that they trust, there may be some component of real effect for whatever outcome that you're looking at, but there's also likely to be some placebo benefit.
Oh, sure, 100%.
If your expectations are set that this is going to make your belly feel better or something like that, So there may be some real effect that I can't say that I've done all the reading to be able to make confident claims about, but there's almost certainly going to be a placebo effect, especially if you've been reading about this stuff on the internet.
Sure, yeah. So maybe stay off the internet.
Works for us.
Yeah, right. Excuse me. Let's see. Just discovered your podcast and working through the episodes. Can you point to any that contain information you've moved on from now in a significant way? The one about the novice progression.
Sure.
I mean, just because I wouldn't recommend resetting, retooling, doing anything to make it go. I would just change.
Yeah.
Because it doesn't matter. Your first 3 months of training don't matter outside of compliance.
Habit building.
Correct. Yeah. Like getting something you're excited about, developing your social circle at the gym, community-based pursuits of fitness.
Mm-hmm.
Cool. Does Barbell Medicine have a program, or do you recommend a program for someone whose sole purpose is aesthetics? I think that any good strength training program is also a hypertrophy program, because muscle cross-sectional area, muscle size, muscle hypertrophy is very important for strength display. So all of our programs are written that way, insofar as we want you to get stronger, we want you to get more self-efficacy to be built up over time, habits to be built over time, and also you to gain some muscle mass. So I think you could do a lot worse than using any of our programs. The hypertrophy program would be the obvious recommendation. Anything else?
Yeah, I mean that's a fine answer. If the person is specifically looking to do bodybuilding stuff, then I don't coach bodybuilders. Same. I know you've coached maybe a couple people who do figure, but
figure folks.
Yeah,
it's the Southern Bodybuilding Association.
Yeah.
Figure folks.
Yeah, so I'm not a bodybuilding coach, but
just kidding. Is Barbell Medicine still accepting clients for individual coaching?
Yep.
Yes. Back tweak on Friday. Back to work sets today. Thank you both for that. Is lumbar osteoarthritis a common finding on CT or concerning at all? Car accident 2 years ago. Incidental finding.
Yep. Super common.
Yeah.
Wouldn't worry about it.
The humanoid condition.
Yep.
All right. Hey, Jordan, I think the Barbell Medicine forum spam filter has blocked some of my posts going through all sitting unapproved. Should I just email info@barbellmedicine, my account name? No, I probably wouldn't. It's highly likely we just haven't gotten to your posts yet because seminar.
Yeah, I tried to answer like 15 posts or something earlier this morning. We don't always get to everything, and if that's the case, then sometimes you might try posting it in the unmoderated section, and some of the other folks in our community might be able to chime in. So the moderated Q&As that are ours and Leah helps with and Alex helps with, they're a challenge to keep up with the busier we get. So just be mindful of that as a free service.
Mindful forum posting.
Yes.
All right. To what extent do you agree with the book Strength is Specific? A lot.
I think, yeah. I mean, I think that based on the current evidence base of what we have on the stuff, that it's pretty good. I would not be surprised, of course, if some of it ends up turning out to be wrong at some point. But
it would be more surprising if nothing turned out to be wrong.
Right, exactly.
Like he just
at some point he's going to change his mind on things as more evidence comes out. But I think that based on what we have now, we like it and we've recommended it. So
I concur. Do pes planus, flat feet, dramatically affect squatting? No.
Nope.
Not reliably. Unless somebody tells you that you have flat feet and that's going to cause you to have bad outcomes and you need to do all this other stuff differently and whatever. And there's like a Instagram account that like circles some people's feet and then their knees and draws line. I know.
They're like foot guys.
The foot guys.
It's kind of weird. The Foot Collective, I think it is, or something.
Whatever.
They're weirdos. Yeah.
Whatever.
Anyway, next.
My father-in-law sent me an article about a study. An article about a study. Oh, good. About an article about a study published in the European Heart Journal that endurance training increases longevity, but resistance training does not. How to counter?
Well, there's ample evidence.
Yeah, that
for resistance training decreasing mortality, which means it increases longevity.
Yeah, same thing on endurance training, and that there are thresholds for each. So, I don't know why. The better question would be, why is your father-in-law sending you an email about an article, not primary literature, suggesting that, doing one or the other is the correct answer? That's like, that's silly. That means that somebody doesn't understand the whole situation. Well, so how should you do what should you do? Nothing. Just let it go. It's your father-in-law. Like, nothing good is gonna come from this. Just let it go. Like, if he wants to run and not squat, like, that's fine. That means he'll be around for a shorter period of time, which is great for you. So, I assume.
Yeah. I mean, this is another situation where we see like tribalism kind of stuff come out, 100%. Right? Where lifters are hardcore about lifting. They think lifting is the best thing ever and it's better than everything else, bar none. And same thing with the endurance athletes, and everybody wants to say the way I do it's best and the way you do it doesn't do anything, which is, it's wrong. So just, strength and conditioning, do both.
Yeah.
It's good for you.
Yeah, if somebody told you don't do cardio,
be like, why?
Why? Sorry, it's hard to ignore like robust evidence to the contrary.
Okay. Doc, how do I recover from this cold weather? My ear and nose are stuffy.
Just live your life.
Just continue living your life. Yeah, if you have an intact immune system, I think you're going to be okay.
Yeah.
You might not even be sick right now. I mean, stuffy, that's just, non-specific. Alternatively, you could have like a space-occupying lesion in your like frontal sinuses. I feel some pressure.
Yes.
Let's see. Any tips for a cramped, fatigued lower back on deadlift days?
Probably a programming issue.
Yeah. I mean, if you have acute fatigue that's in excess of what you can tolerate for whatever reason, this could be life stress, a combination of life stress and previous training stress, or the program is, ultimately inappropriate for your current level of training, then maybe you would go a little lighter that day, just, but you would also make sure that your program has some sort of like auto-regulating parameter to it. Like RPE will limit the amount of weight on the set based on your performance capabilities that particular day. On the other hand, this might be the third hand.
Okay.
Just because you have some lower back fatigue, I don't know if I would do anything differently on that day. If you're worried about getting hurt, then all right, that session is not important enough to just, I got to stick to the numbers, YOLO. But at the same time, if you're not necessarily worried about it, you're like, my low back is tight. Like, I don't just continue.
We both squatted today, and we're both going to go in and deadlift tomorrow, and our backs aren't going to be 100% fresh.
Yeah.
So we just warm up and see where it's at for the day.
I like on Friday after that miss on the 2-count pause deadlift, you were like, you tweak your back or something? Because I don't normally drop the weights.
Yeah, I know.
I was like,
that's why I asked it.
Yeah, and I was like, maybe, but it's fine. And then I just pulled 545 for 4 after that.
Yeah.
So
I wouldn't do anything differently just because. Let's see. Do you have therapy recovery recommendations for suffering from elbow bursitis? Not general. I mean, adjusting range of motion, weight, total volume, frequency, exercise selection. But if you want specific recommendations, I think Mike and Derek would be.
Yeah. I mean, they have a Q&A on our forum. They may be able to help. But in general, for most of the injury and pain questions that are going to come up in all these platforms that we're streaming on, we generally treat them as load-based issues outside the context of trauma.
Trauma?
Yes, they're load-based issues. So, having to do with intensity, frequency, volume, something that's above your, more than you were prepared to handle. So that's the way we would approach those. So maybe there's something that needs to be modified about your programming in the short term to get you back to your normal level of activity and performance.
Does Barbell Medicine have a program, or do you recommend a program for someone? Gosh, we are.
Aesthetics?
That's a good one.
Do look how aesthetic I am. Are all carbs the same?
Nope.
Even for trainees who have been diagnosed with prediabetes. Well, the overall evidence on diabetes and prediabetes is that it doesn't necessarily matter if you go low carb or high carb, provided you're in a calorie deficit, and weight loss can improve your outcomes. I would, in general, recommend people to eat higher fiber
just as a general sort of rule, but I wouldn't necessarily go after different types of carbs like, ooh, that's rice versus a potato, right? It'd just be a total calories, total fiber intake sort of deal. All right. 2 weeks post-op appendectomy, laparoscopic approach, any experience with recovery? Surgeon wasn't very clear on what to do in the gym. He said take it easy for 4 to 6 weeks.
Yeah, we have a lot of people who ask these kind of questions on our forum for post-op surgical clearance. And yeah, there's no evidence on this stuff, so all these recommendations are typically made up. We cannot and will not comment on your specific case. We are not your doctor and, can't give you direct medical advice, but we've had lots of folks post-laparoscopic surgeries like an appendectomy who have started training on their own, accord, probably somewhere between 2 and 3 weeks post-op, and they, in general, do okay. But, of course, we are not commenting on your specific case.
Yeah.
So
my friend has Ehlers-Danlos syndrome and constantly talks about having pain. Would Austin take someone with this on as a client? He might. You want to suggest him to her?
Yeah, I mean, it sounds like that they need some
Reassurance.
significant education as it pertains to their condition, and if they're exercising, if they're not exercising, they need to exercise. If they are, then they might need some modification of that. So if they wanted to submit an inquiry for a consult, we'd be happy to help.
Sure. Did the CrossFit template come out this week? It is being tested by our beta testers right now. Yeah. All right. The term inflammatory is thrown around so much within the fitness industry, especially in regards to nutrition. Could you clarify what we know about inflammation and its relationship to food?
Mm-hmm.
No. Well, so there are 2 dietary inflammatory indexes that have been validated to the extent that they can be validated. That being said, they're not associated with medical like diseases or worsening of certain conditions. They're just basically a lab number, that goes up that they call it inflammatory, but it's not in a pathological range. So it's like you don't know what it means. Like if your CRP goes up 1.5 points and you're still below the normal range.
Yeah, it's not a patient-centered outcome.
Correct.
That's what you're getting at.
Yeah, so you could have just trained or strained hard on the toilet potentially.
Or lab variability.
100%.
Stuff like that.
Yeah. So I don't know what to make of it. I think the best thing I can say is that I would not try to manage any inflammatory condition via choosing different foods over another. Rather, the biggest inflammatory condition that we can manage through nutrition manipulation is obesity. Because your fat tissue is a biologically active organ tissue that is secreting a lot of biologically active substances that do in fact influence your inflammatory situation considerably. So if you are overweight or obese, or you're carrying too much abdominal tissue, fat tissue, which you would know because your waist circumference is elevated, we have a waist circumference video that you should review, then losing weight would likely help that, not necessarily picking a lower inflammatory food itself.
Yeah. The only situation where I can think of food causing like a real inflammatory response would be in the setting of specific food allergies or anaphylaxis. That's pretty inflammatory. If you have a shellfish allergy or something, you eat some of that. I think the rest is pretty nebulous, and the problem is that because of the quality of information that there is on the internet, you might hear things like, this food causes some stomach upset, or it might make you feel bloated, and that means that your gut is inflamed or something like that. And that requires a higher level of evidence to support that claim. That would require something like an endoscopy and a biopsy to prove that you have cellular inflammation in your gut lining or something like that. So inflammation is a major kind of woo word in the
I like that.
the health scene on the internet, and we need to be careful when we throw around the term inflammation.
Sure.
Just like we were talking about earlier, throwing around the word inflammation with tendinopathy because it's inaccurate.
Yeah.
So.
And look at this guy. You see this? Where's he at? Low pH said that I was looking skinny. Damn. Got him. Moving down the 83 kilo class. We'll doing the same lift 2 or more days in a row, say bench, disrupt the SRA cycle, stopping gains.
Nope.
No, and the SRA cycle does not comport with what we know about how people get better from exercise.
Well, I would say that it's not as discrete as you think.
Well, that's what I'm saying. That's what I'm saying.
Right.
Like, you're just not a discrete stress and then recovery and then adaptation. It's always happening all the time.
We're not machines.
turns out we're not machines.
Yeah. What's next?
Who's next? I have no idea if I peak fast or slow, but I match the small description of the quiet, lower hype description. Should I go with the fast peak template after the 12-week strength for a meet? Well, I wouldn't do the peak template after the 12-week strength. I would do it as the last 3 weeks like a plug-in. I would pick one, see how you did, and then do it again sometime in the future and pick the other one and then compare notes. All right. If you're running the bridge and cutting, what to do when the RPE is getting heavier? Lower the weight to make sure that the RPE is correct.
RPEs don't get heavier.
That's also true. Sometimes the heaviest thing we lift are our feelings.
Yeah, that question represents a little bit of misunderstanding about how autoregulation works, I think.
Sure. If two people have the same body composition and weigh the same, will their basal metabolic rate be identical? No. Is there such thing as a faster metabolism where one could use more calories? I did a whole expose on metabolism. 10 out of 10 would recommend. It's on our YouTube channel.
Go check it out.
Yep. All right. Thoughts on lifting 5 to 6 days a week for intermediate advanced lifters if you really enjoy lifting and want to spend more time in the gym? How would you structure training other than bro split, multiple GPP days? I think that using training frequency to manipulate total training volume is how we do it, and I think I could figure out a way to make a 5-day training template work. I don't think a bro split is the best for getting stronger, and I would, I guess, wonder where you're at in your training to retrain.
I think there's too much information that we need. I've programmed for, I think, 2 people who I had trained 5 days a week for various reasons, mix of preference and life schedule and stuff like that. But I had to get to know a lot about them and why we were doing it and what their work schedule and life schedule was like to make informed decisions about that. So,
what is your opinion on squatting with the camber bar attachments? I remember you did a little work with them a month or 2 ago. Yeah, I think they're a fine variation.
I've not used a cambered bar myself, but looks cool.
Sure. Any tips on how to minimize the bloat of cruciferous vegetable intake?
Maybe eat a little less?
Yeah, try eating less. You could cook them a little bit more. You could not pay attention to how bloated you're getting, since that is an unreliable, subjective sort of thing. Bloat scale?
Yeah. RPB.
RPB. Let's see. Recently started experiencing pain in one hip when squatting. I've also noticed that one of my hips is higher than the other. Lateral pelvic tilt. Okay. But hasn't always been like this. Could this be related?
Probably not.
Seems unlikely.
Yeah. We generally look more towards how your training's been going in terms of your programming, intensities, training volumes, stuff like that. We look for changes on that stuff rather than structural anatomical issues as being the first kind of target for suspicion. So if you need some more help with that, I would post on our rehab Q&A, and we can get you taken care of there.
So does deadlifting with bad form not lead to injury? Nope.
I would suggest listening to our injury podcast. That explains things in a lot more detail.
The answer is nope. How do you know when you are ready for your first meet? If you have the money to sign up for a meet that happens to be accessible to you geographically,
and you want to do it,
and you'd like to do it, those would all be the signs that it's time to do a meet. You'll never be strong enough to go do a meet, right? So I could sign up for a meet and go win or get destroyed depending on who shows up. So am I not strong enough to do a meet if, the top 10 people from USAPL Raw Nationals are going to show up?
Yeah.
Or, am I too strong to sign up for a local meet if nobody else is going to be there? I mean,
it's just a meet. Don't overthink it.
Yeah, it's completely arbitrary.
Just do it.
Yeah. Or don't.
Or don't.
I wish that I was recording.
That was like what happened last time.
Yeah. Nope. When will the Philadelphia Q&A Part 2 come out? Austin said that I can't post any more Q&As for a while.
Until we have other content, which I think we have coming.
Yeah, it's true. So, what are your thoughts on squatting in flats?
Cool.
Yeah, neat. What kind of flats are you squatting in, bro? What kind of shoes are those? Let's see. Is cardio on a cutting diet bad? No. Okay. Let's see.
Let's skip some of these.
All right, fine. Hi, doctor. Is RPE a crucial factor for beginners who have completed 1 LP?
Does a program have to have RPE in it to be useful?
No.
No. But it would be hard to think of another auto-regulatory variable that's as easily accessible as RPE.
Right. So if the question is distinguishing, is it absolutely a crucial factor versus is it useful enough to justify its use?
Yeah, well, it's always going to be there regardless whether you want it to be or not.
We just think it's useful. If you don't want to use it, then do whatever you want.
Do
but
your thing.
You have to understand, as we discussed in our injury podcast, that there needs to be some way of kind of a subjective assessment of training load as perceived by the trainee, because that is a strong correlate for injury risk. Unless you just want to say, I don't care about the lifter's subjective feelings in the context of their training and how they're perceiving the training, in which case you are exposing them to unnecessary injury risk and you are not doing as good of a job as you can as the coach.
Is that right?
Yeah.
Let's see. If I pull Sumo, oh, dang it. You see how it
It scrolls you down to the bottom.
Yeah, dude, does that. Should I stab myself with an EpiPen before I do a 1-rep max?
Totally. I
Definitely.
saw that in Crank.
Well, Crank's the name of the new pre-workout.
Right.
Yeah. Maybe we should just do an injectable. Just like single serves, just like EpiPens.
Single use.
Yeah,
yes.
yeah, it's fine. Okay. Should you do overhead presses if you have kyphosis? Sure. Kyphosis wouldn't limit me from recommending anything to anyone.
Did you know that everybody has kyphosis
That's
in their
true.
thoracic spine?
Yeah, you're like supposed to. It's like a primary curve in your thoracic and sacral spines.
Yeah.
Yeah.
Oh man, but
If I just tell you that you're special and you have a problem, then maybe I can tell you something. Ooh, got him.
Kyphosis template.
Kyphosis template. Yeah, that's right. Who was that guy in your Throwback Thursday? Oh, in your IG story. Oh, that was Dickie. He's a ortho resident in Chicago. Bros. Let's see. When the weight on squats gets above 90%, I tend to slow down.
Same.
Yeah. Yeah. So the way to get better at doing squats above 90% is to do more squats above 90%.
Yep.
Yep. What's up, Jordan? It's Jimbo. Hey, Jimbo, what's up, man? Dang, dude, it's been a minute. I like that people text me. Did you know that everyone has a kyphosis? That's funny. What do you normally program leg press for? Just additional leg training.
Yeah.
And people who have a leg press, I'm jelly of a leg press.
Same. I mean, well, at least you have a belt squat now. I mean,
Yeah,
we
that's
think
true.
that at this point, my thinking is that most people, in order to continue driving their squat up long term, one of the more useful things that they can do is to, develop additional quad strength, develop additional leg strength, and to the extent that adding more squatting into their training would produce so much fatigue that it would potentially limit their deadlift training, then we might choose alternative ways to accumulate more leg training to spare their back such that they can pull more.
Yeah. Yep.
Depending on the athlete, if that's what they need. Some people are not that. They have super, I have one of my lifters who has just insanely strong, great, really, really, really good leg strength. He just, every single squat he does, moves really, really fast. It was Caleb. I showed you his 570 paused squat the other day.
Yeah.
But we've had to put a lot more work in his deadlift to get his deadlift working. So he's the other side of the spectrum where I don't throw, tons of extra leg work at him, but we have him do a lot of extra back training to make his deadlift go. So
Back training.
depends on the lifter.
Training legs.
Yeah.
Hey, Jordan, thoughts? Oh, dude. Is real-time MRI a thing yet? Nope.
I mean, you're in the MRI while the images are being taken, and there's functional MRI, I guess, while you're.
Yeah, I'm trying to understand what they mean by real-time MRI.
Is real-time MRI
if you're looking at the images as they're being acquired, which I don't know because I'm not a radiologist. There is, you can look up cardiac MRIs, and those are actually very cool. You could probably find them on YouTube, where you can watch the whole cardiac cycle during the MRI. You can see actual motion. It's not just static images. So if that's what you mean, then yes, those exist.
Yeah. So the physicians keep talking about the limitations of static imaging in
relations to a disc injury.
Yeah,
Find a new
I
clinician.
think there's limitations to imaging in the context of disc, quote-unquote injuries.
Ooh.
So that's a whole different topic. But
Got
yes, we have non-static. We have dynamic kind of imaging, and cardiac MRI is the best example of that, I think.
Get them.
Yeah.
Will we see studies push variations the same way we're seeing volume push in upcoming studies?
There already are a couple studies on variations that we've cited before.
Yeah.
What is it? The
Fonseca
paper. That's one of them. But
okay. There's that second paper.
we just expect all of this to be researched more.
Yeah.
Just gonna keep coming.
Just gonna keep on living our lives. Let's see. If I pull sumo, should I use a sumo deadlift or conventional stance on stiff-legged deadlifts and RDLs? I would do those conventional.
Same.
Hard to do sumo.
Additionally, when we have people who switch to sumo, when they switch all of their pulling over to sumo, all their supplementals and all that kind of stuff, we've seen kind of an increased rate of some discomfort associated with that, I think, due to just the sudden change of all of those things. So if somebody's used to pulling conventional and they want to switch, we'll oftentimes just switch one of their variations over, keep the others conventional, and then move the others over as needed to keep driving progress. So.
That's true. Let's see. Any suggestions for powerlifting and physical therapy in the New York area? Sure. Powerlifting, you go to CrossFit South Brooklyn. Actually, it's not a CrossFit gym anymore. Oh, so CrossFit South Brooklyn is the one gym, and then South Brooklyn Weightlifting Club is the powerlifting gym. That's Paulie's place. Squats and Science, that place. Murder
of Crows,
Murder
Barbell
of Crows,
Club.
yeah. Rory Alter and John Patrizio and Nick D'Agostino are all out there and could help you if you need a PT.
They're good people.
Yeah. All right. Is Zivia any better than diet sodas being a natural sweetener versus artificial? No, it might be worse.
Zevia is disgusting.
Tastes gross.
Yeah. Would not drink.
This guy asked if lifting will get him a girlfriend. And the answer is...
No.
No. It'll get you dudes.
Yeah.
It'll get you dudes for sure.
See, that's how this happened.
Yeah. Bromance. Bro. Okay. Thoughts on some other program? I have none. Coffee versus Monster.
Have you ever drank a Monster?
I think I might have had one Monster in my life when I was swimming in high school.
No, dude. You remember we were going to what was that gym we went to in San Antonio?
Oh, when we went to Heavy Metal?
Yeah.
Did I drink a Monster?
Yeah.
That might have been the second
That
Monster
was
I
it.
had
That
in
was
my
the second
life.
Monster. I like coffee over Monster.
Same.
But the caffeine, intake it's on a per person basis. All right. In a nutshell, what is really wrong? Oh God, what is really wrong with LP?
Can we not?
No, let's do it. This is gonna be the last question. Boom. In a nutshell, what is really wrong with LP? Okay, here we go. Thing one, it's hyper specific because you only have 4 lifts. Okay, maybe 5 lifts. And there's no exercise variation. All of our motor learning studies suggest that you get better at doing a particular physical task if you do variations of that task. Okay, so being hyper-specific worsens your motor learning trajectory. The rep range is also hyper-specific, meaning you only get strong at 1 rep range. It's not great for singles. It's not great for 10s. It's not great for 20s. It's just better. It gets you better at doing 5s. It also only gets you better at the endurance demands of 5. So if you are not going to a competition where you're doing a 5 RM, it is inadequate at getting you stronger, okay? And the progressive overload characteristic of that particular program is lacking. It doesn't add volume. It doesn't necessarily add intensity because as you add weight, you're supposed to be getting stronger commensurate with the increase. So, for instance, adding 5 pounds, if your 1RM went up, doesn't actually make you work at a higher average intensity. It's just the same. And finally, it only lasts on average for 9 weeks, meaning that being married to this program seems foolish AF.
I don't really care.
Well, that's what I'm